Hi everyone, this is Nurse Sam. He is our triage nurse today, and we are going to see how he uses the Emergency Severity Index algorithm, also known as ESI, to assign acuity levels to patients during triage presenting to the ED. ESI is a systematic approach to determining patient acuity. The algorithm provides the nurse with decision points that takes the patient presentation, chief complaint, vital signs, and resources needed to care for the patient into consideration. Decision point questions include: does the patient require a life-saving intervention? This is an intervention for airway, breathing, circulation, disability, or a life-saving drug. Is this a high-risk situation? Is there potential for a poor outcome? How many resources do they need? And what are their vital signs? The ESI algorithm provides acuity levels 1 through 5 based on how the questions are answered in relation to patient presentation and resources needed. Danger zone vital signs are considered based on heart rate, respiratory rate, and oxygen saturations for all ages. Patient age, history, blood pressure, and temperature should be considered when determining leveling. Resources to care for the patient include labs, EKG, radiology imaging, IV/IM or nebulized med, simple procedures, and complex procedures. Resources are not point-of-care testing, oral medications, prescriptions, simple wound care, or orthopedic appliances. Here come some patients. Let's look at how Sam applies the ESI algorithm to their triaging process. The first patient states, "I just had knee surgery 2 days ago. Today I am short of breath and it hurts to take deep breaths." Sam notes the vital signs as abnormal during triage. The patient's recent history and presentation of symptoms is concerning for a poor outcome. Therefore, his ESI is 2. This patient states, "I am having abdominal pain, nausea, and constipation." Sam does not notice anything in this patient's recent history, presentation, or vital signs that concern him for a poor outcome. She will need more than 2 resources to care for her today. Therefore, her ESI is 3. This patient's mother tells Sam, "My baby has had a cold for 3 days with fever, congestion, and a bad cough." The baby's vital signs are abnormal. His young age and fever should be a consideration of his potential for a poor outcome. His ESI is a 2. This patient states, "I am here to get my sutures removed from my hands." Vital signs and assessment are within normal limits. Sam realizes that this patient requires only minor care of her suture removal and no resources will be needed. Her ESI is 5. An ambulance has just arrived with a 52-year-old man with left arm pain. He is lightheaded and diaphoretic. Sam notices that this patient's presentation and abnormal vital signs will require an immediate life-saving medication intervention. Therefore, the ESI of this patient is 1. Thanks for your help today, Sam. Key points to remember: ESI is based on immediate interventions, high-risk situations, and resources needed. Consider the vital signs, age, history, and presentation of the patient when determining levels 1 through 5. Remember, these acuity levels communicate severity illness to staff and prioritize their care. Thank you for viewing my video presentation on ESI algorithm and its use for patient acuity in the emergency department for patient triage. For further reference, you can refer to the Emergency Severity Index Handbook, publication in 2012, version 4, as referenced below. Thank you again.